You are petting your cat when they roll over and you notice it. Their belly is completely bald. You probably never catch them in the act of licking or biting the fur. Finding mysterious hair loss on a pet leaves most owners feeling helpless. We are dealing with feline self-induced alopecia, or FSA. By the end of this video, you will know how to physically test for it, identify the hidden stressors triggering the behavior, and implement a precise healing plan. To start, you need to gently secure your cat in a well-lit room for a close physical inspection of the affected area. Moving from feeling helpless to actively investigating the problem is the first step in stopping the hair loss cycle. Once your cat is comfortable, gently roll them over and implement a precise healing plan. To start, you need to gently secure your cat in a well-lit room for a close physical inspection of the affected area. Moving from feeling helpless to actively investigating the problem is the first step in stopping the hair loss cycle. Once your cat is comfortable, gently roll them over and look very closely at the exact edge of the bald patch. We are looking for the physical difference between naturally shedding fur and active trauma. If hair is falling out naturally, the remaining strands look clean and intact. This illustration shows the difference. On the left is normal hair loss. On the right, the hairs are barbered. Because a cat's tongue is incredibly rough, it chews and breaks the hair away, leaving jagged, uneven lengths of broken stubble. Next, look directly at the bare skin underneath that stubble. This layout compares healthy skin to an infected area. People often misdiagnose this hair loss as a bacterial or fungal infection. If it were an infection, you would see redness, pimples, and severe inflammation, like the image on the right. Broken hair stubble combined with perfectly clear skin is definitive proof. Your cat is chewing the hair off themselves, which allows us to rule out external diseases. Medically, this condition is called psychogenic alopecia. This means the hair loss originates entirely from the mind. Domestic cats are natural predators. When they live entirely indoors, there is a constant biological conflict between their drive to hunt and the static environment of a house. Without enough environmental stimulus to engage those instincts, boredom sets in. Over time, that boredom compounds into frustration and depression. To cope with this hidden stress, the cat needs an outlet. They soothe themselves by obsessively licking their bellies until the skin is bare or broken open. Hidden physical stressors multiply this psychological toll. Specifically, carrying extra weight causes significant underlying physical and emotional stress for a cat. The bald belly serves as a physical alarm bell, signaling a critically unmet psychological need. Because the root cause is stress, punishing the cat or interrupting the licking will not work. We have to treat the environment. Step 1 is the environmental enrichment phase. You need to increase their daily interactive stimulus, aiming for multiple play sessions every single day. Introduce play sessions using feather wands or lasers that force them to run and track targets. Then add vertical climbing spaces to satisfy their territorial instincts. Replicating the physical exertion of a wild hunting cycle biologically diffuses the anxiety that drives the destructive grooming loop. Next, we add environmental calming aids. Plug-in diffusers emit synthetic feline facial hormones into high-traffic rooms, creating a baseline sense of safety. The second natural intervention is an oral supplement containing mother's milk protein extract. This diagram shows how the extract works. Protein molecules enter the system and bind to neural receptors, actively lowering the brain's stress gauge. This replicates a kitten's calm state, applying that biological soothing effect to an anxious adult cat. Leveraging these natural biochemical pathways lowers your cat's panic threshold without the immediate need for heavy pharmaceutical sedatives. Throughout this process, officially partner with your veterinarian. They need to physically examine the bald patch to rule out any deeply hidden medical issues. For severe cases of psychogenic alopecia, there is a medical escalation path. Your vet can prescribe anti-anxiety medications like Prozac or clomipramine. Clomipramine is a tricyclic antidepressant used in veterinary medicine to treat obsessive-compulsive behaviors. Pharmaceutical intervention is a powerful tool to break ingrained behavioral loops, but it will fail if the foundational environmental and enrichment changes are not implemented first. The complete protocol works in sequence. Confirm the barbered hair, audit the environment, increase physical enrichment, and introduce natural biological supplements. When you satisfy their predatory instincts, the obsessive licking stops. You get a calm, mentally stimulated cat whose belly fur can grow back. Take a moment today to physically inspect your cat's belly. If you see those broken hairs, schedule an extra play session this evening. A fully healed coat is the visible proof of a mentally enriched feline companion. Subscribe for more actionable pet health solutions.